If someone told you that a morning urine pH below 6.0 means cancer cells are multiplying in your body right now and you're over 60, you need to hear this, because that frightening claim is not what the evidence shows. In fact, after more than 30 years in emergency medicine, I've seen hundreds of seniors become terrified by urine strips, internet articles, and health claims that sound scientific but leave out critical context. Now, here's the strange part. Your urine pH can change from one morning to the next. It can change because of what you ate, what medications you take, how much water you drank, and even when you last exercised. Yet many people are being told that a single number on a urine strip reveals whether cancer is growing inside them. It doesn't. And the reason nobody told you this isn't secrecy. It's that most medical appointments are too short to explain how these numbers actually work. Today I'm going to give you the complete picture. I'm Dr. Richard Hartman. I've spent more than 30 years in emergency medicine and have treated over 10,000 older adults. After decades in busy emergency departments, I've noticed a pattern. Many of the health scares that worry seniors most come from misunderstood test results. Urine pH is a perfect example. A simple measurement becomes attached to dramatic claims. Then good people spend weeks worrying about something that may not mean what they think it means. In this video, I'm going to show you 3 things. First, what urine pH actually measures and why it changes after age 60. Second, what the science says and doesn't say about urine acidity and cancer. And third, what health markers deserve your attention if you're trying to stay independent and healthy for decades to come. Quick favor before we start. I regularly hear from viewers who watch several videos before realizing they weren't subscribed. Could you check right now? It's free, takes 2 seconds, and helps this information reach people who need it. Now here's why this matters after 60. As we age, kidney function gradually changes. Medication use increases. Many people take 3, 5, or even 10 prescriptions daily. Hydration habits change, diet changes. All of these factors can influence urine pH. So if you're over 60, the rules really are different. And understanding those differences can save you a lot of unnecessary fear. Picture this. You're standing in your kitchen making breakfast. You dip a urine test strip into a sample because you saw a video online. 30 seconds later, the color chart says your pH is 5.8. Then you read a headline claiming that acidic urine means cancer cells thrive in your body. Suddenly, breakfast doesn't matter anymore. Now you're wondering whether something dangerous is happening inside you. You start searching online. Every article seems more alarming than the last. Some claim you need to alkalize immediately. Others suggest expensive supplements. A few even imply that conventional doctors are hiding this information from you. I've seen this exact scenario countless times. Most people assume urine pH reflects the acidity of their entire body. But here's what actually happens. Your body works incredibly hard to keep your blood pH within a very narrow range. If blood pH drifts too far outside that range, it becomes a true medical emergency. We're talking about a range so precise that even small deviations can cause serious problems. Your body knows this. That's why it has multiple backup systems to maintain that balance. Urine is different. Urine is one of the ways your body removes excess acids and maintains balance. Think of it like household trash collection. The trash can outside your house tells you what was removed. It doesn't tell you the condition of the house itself. You might throw away old batteries one day and vegetable scraps the next. The content of your trash varies, but that variation doesn't mean your house is falling apart. Your urine is often showing what your body is getting rid of, not necessarily what's happening in your tissues. Now here's where it gets interesting. A lower urine pH in the morning is often completely normal. During overnight fasting, your metabolism changes. Your kidneys adjust. The first urine of the day is frequently more concentrated. Your body has been processing and filtering all night without any new fluid intake. That concentration affects pH readings. That's one reason morning values can appear lower than people expect. The problem begins when normal variation gets turned into a frightening story. And that's where confusion starts. Someone takes that normal morning reading, compares it to a chart they found online, and suddenly believes they're in danger. They don't know that the person who slept next to them might have the exact same reading. They don't know that Olympic athletes and healthy teenagers can also have acidic morning urine. Let me tell you something most doctors don't explain. The human body is obsessed with balance. Your kidneys, lungs, hormones, and circulation systems are constantly working together to maintain stable internal conditions. These systems communicate through complex feedback loops. When one system detects a shift, it signals others to compensate. Think of it like a home thermostat. You set the thermostat to a comfortable temperature. When the room gets too warm, cooling systems activate. When it gets too cold, heating systems activate. Your body does something similar with acid-base balance. It monitors blood chemistry continuously. When acid levels rise even slightly, buffering systems respond within seconds. Your breathing rate might change. Your kidneys might alter how much acid they excrete. All of this happens automatically, without you thinking about it. Urine pH simply reflects part of that balancing process. Now imagine a factory with quality control managers. Every day, the factory produces products and waste. The waste leaves through a disposal system. If you examine the waste leaving the factory, you're learning something useful, but you're not necessarily learning whether the factory itself is functioning poorly. The waste might be perfectly normal byproduct of efficient production. It might vary depending on what raw materials arrived that day or what products were manufactured. Urine works in a similar way. After age 60, several factors influence urine pH. Dietary patterns change as people eat differently than they did in their 30s or 40s. Some eat less protein, others reduce carbohydrates. Many increase fiber intake after hearing it's heart healthy. Hydration status becomes more variable because the thirst mechanism can diminish with age. You might not feel as thirsty even when your body needs fluid. Some older adults intentionally drink less to avoid nighttime bathroom trips, which ironically makes urine more concentrated and can lower pH readings. Kidney function naturally declines gradually after about age 40. This isn't disease in most cases. It's normal aging, but it does mean your kidneys handle acid-base balance slightly differently than they did decades earlier. Prescription medications add another layer of complexity. Diuretics, blood pressure medications, diabetes drugs, and even some supplements can influence urine chemistry. When you're taking multiple medications, those effects can combine in unpredictable ways. Diabetes management matters too. People with diabetes or prediabetes may have different metabolic patterns that affect urine composition. Blood sugar control, insulin levels, and how the body processes fuel all play roles. Recurrent urinary tract infections can alter urine pH as well. Some bacteria change the chemical environment, making urine more alkaline rather than acidic. That's why a single reading rarely tells the whole story. Here's the myth that keeps circulating. Acidic urine means cancer is growing. Here's the reality. Cancer biology is far more complicated than a urine strip reading. Cancer involves genetic mutations, immune system function, growth signals, blood vessel formation, and cellular environments that exist at the microscopic level inside tissues. Why does that matter? Because focusing on a single number can distract you from genuine health priorities. Here's the uncomfortable truth. Many cancers develop for years without changing urine pH in any meaningful way. Breast cancer, colon cancer, lung cancer, prostate cancer, these conditions typically don't announce themselves through urine pH changes. They develop silently, which is exactly why screening tests like mammograms, colonoscopies, and low-dose CT scans exist. Meanwhile, people who obsess over urine strips sometimes ignore symptoms that actually deserve medical evaluation. Symptoms like unexplained weight loss. If you're losing weight without trying, without changing diet or exercise, that deserves attention. It could indicate many things, most of which have nothing to do with urine pH. Persistent fatigue that doesn't improve with rest. We all get tired. But exhaustion that interferes with daily activities and lasts for weeks is different. Blood in the urine is another red flag. Visible blood or blood detected on urine test strips should prompt medical evaluation, not home pH testing. Difficulty swallowing that progressively worsens is concerning. So are changes in bowel habits that persist, such as ongoing diarrhea, constipation, or changes in stool appearance. Those deserve attention. A urine pH reading by itself usually does not. So if chasing urine pH isn't the answer, what should seniors focus on? Let's start with evidence-based habits that actually make a difference. Picture this scenario. You wake up feeling sluggish. Your urine appears very dark, almost amber-colored. You assume something serious is wrong. You worry about liver problems, kidney failure, or worse. But often the issue is simple dehydration. Many older adults drink less water because they don't want frequent bathroom trips. This is especially common at night. People reduce evening fluid intake, hoping to sleep through without interruption. During the day, they get busy and forget to drink, or they simply don't feel thirsty. Unfortunately, dehydration can affect energy, concentration, blood pressure, and kidney health. Even mild chronic dehydration can make you feel worse than you realize. You might blame aging when the real issue is inadequate fluid intake. A practical goal is drinking fluids consistently throughout the day unless your physician has given you fluid restrictions. Some people with heart failure or advanced kidney disease do need to limit fluids, but most older adults can safely increase hydration. Here's the exact protocol I recommend. Start the morning with a glass of water before coffee or breakfast. This helps rehydrate after the overnight fast and gets your system moving. Drink regularly, rather than all at once. Sipping throughout the day is more effective than gulping large amounts occasionally. Keep water nearby. If you see it, you're more likely to drink it. Monitor urine color rather than obsessing over pH. Pale yellow is ideal. Dark yellow or amber suggests you need more fluids. Clear urine all the time might mean you're drinking more than necessary, though that's rarely harmful in healthy individuals. Follow medical guidance if you have heart failure or kidney disease. These conditions sometimes require careful fluid management, so always check with your healthcare team. Wait until you hear this next part. The foods associated with lower cancer risk aren't mysterious. They're remarkably boring. Vegetables in all colors and varieties. Leafy greens, cruciferous vegetables like broccoli and cauliflower, colorful peppers, tomatoes, carrots, fruits, especially berries, apples, citrus, and whatever is in season locally. Beans and legumes, which provide fiber, protein, and beneficial plant compounds. Whole grains like oats, brown rice, quinoa, and whole wheat. Adequate protein from various sources, whether animal or plant-based, to maintain muscle mass. Research consistently shows benefits from dietary patterns rich in plant foods and minimally processed ingredients. The Mediterranean diet, DASH diet, and similar eating patterns have decades of supportive evidence. Think of it like maintaining a garden. You don't grow a healthy garden by spraying one miracle product once and expecting perfection. You create healthy conditions consistently over time. You water regularly. You pull weeds. You add nutrients to the soil. You protect plants from extreme weather when possible. Your body works similarly. You're creating an internal environment through daily choices. No single food or single day determines your outcome. It's the pattern over weeks, months, and years that matters. One of the strongest predictors of healthy aging isn't urine pH, it's movement. Walking around your neighborhood or even inside your home. Strength training with light weights, resistance bands, or body weight. Balance exercises that help prevent falls. Daily activity like gardening, housework, or playing with grandchildren. After 60, muscle loss accelerates. Scientists call this sarcopenia. It affects strength, metabolism, balance, and independence more than most people realize. You can lose significant muscle mass over just a few years of inactivity. The patients I've seen remain active into their 80s and 90s usually share one characteristic. They keep moving. Not perfectly. They're not running marathons or lifting heavy weights necessarily. They're not athletes. Not intensely. They're not exhausting themselves daily, but consistently. They move most days. They prioritize it. They don't let weeks go by without activity. Here's what your doctor doesn't have time to explain during a 15-minute appointment. Small daily habits often outperform dramatic health hacks. The internet loves dramatic transformations and miracle cures. But reality is usually less exciting and more effective. Walking 20 minutes daily beats buying expensive supplements and doing nothing. Eating an extra serving of vegetables beats obsessing over urine pH. Let's talk about what the evidence actually says. A large body of cancer research has identified factors associated with cancer risk reduction, including tobacco avoidance, physical activity, healthy weight maintenance, and dietary quality. Organizations such as the American Cancer Society, the World Health Organization, and the American Institute for Cancer Research emphasize these factors repeatedly. They've reviewed thousands of studies. They've analyzed data from millions of people. Now here's where it gets interesting. The internet often cites laboratory studies showing that cancer cells may behave differently in certain microscopic environments. That's true. In laboratory dishes, researchers can alter pH levels and observe how cells respond. Some cancer cells do prefer certain conditions, but laboratory findings do not automatically mean changing urine pH changes cancer growth in humans. Those are very different questions. Laboratory dishes don't have immune systems, blood flow, complex tissue architecture, or the countless variables present in living humans. What happens in simplified laboratory conditions often doesn't translate directly to human bodies. A 2020 review published in major oncology literature noted that tumor environments are complex and cannot be reduced to simple urine measurements. Tumors create their own microenvironments. They alter pH locally within tissues through metabolic processes. But that localized tissue pH bears little relationship to urine pH. That's a crucial distinction that gets lost in social media posts. Another important point, researchers use blood tests, imaging studies like CT scans and MRIs, biopsies examined under microscopes, and sophisticated molecular tools when evaluating cancer. They do not diagnose cancer by looking at whether someone's morning urine pH is 5.8 or 6.2. That's simply not how oncology works. No cancer treatment center bases decisions on urine pH strips. Think of it like trying to evaluate an entire house by examining one brick on the exterior wall. You might learn something about that brick. You might learn what material it's made from or how old it is, but you won't learn enough about the foundation, the plumbing, the electrical system, the roof, or whether the house is structurally sound. Here's what the clinical guidelines don't mention in social media videos. Medicine rarely relies on single measurements taken out of context. Patterns matter. One high blood pressure reading doesn't diagnose hypertension. One elevated blood sugar doesn't diagnose diabetes. Doctors look for patterns over time. Context matters. Your symptoms, medical history, family history, medications, and other test results all provide context that changes interpretation. Symptoms matter more than isolated numbers in many cases. How you feel and function often guides medical decisions more than borderline laboratory values. Risk factors matter. Your personal risk based on age, genetics, lifestyle, and previous health conditions influences what tests are necessary. That's how real clinical decisions are made. It's more complicated than checking one number and panicking. Let's go through the biggest mistakes I see people make with urine pH testing. Some people check urine pH multiple times every day, morning, afternoon, evening, before bed. Then they worry about normal fluctuations. They see their pH is 6.0 in the morning and 6.5 in the afternoon and wonder what went wrong. Your body changes throughout the day. Food intake changes, activity levels change, hydration changes, metabolism shifts from fasting to fed states. That variation is expected and normal. Testing repeatedly doesn't provide useful information for most people. It just creates more opportunities for anxiety. Many prescriptions influence urine chemistry, diuretics used for blood pressure or heart failure, medications for gout, certain antibiotics, even vitamin supplements, especially high doses of vitamin C or calcium. If you're taking multiple medications, interpretation becomes more complicated. A change in urine pH might simply reflect medication effects, not disease. Never stop medications because of a urine strip result. That's dangerous. Blood pressure medications, diabetes medications, and others need to be stopped only under medical supervision. Stopping suddenly can cause serious problems. Always discuss concerns with your physician before making medication changes. Here's a classic example of another common mistake. A person changes their diet after reading about alkaline eating. Their urine pH changes over the following weeks. They feel better, more energetic, lighter. Then they assume the pH change caused the improvement. But perhaps they started eating more vegetables and fruits, which increased vitamin and fiber intake. Perhaps they started walking daily as part of their new health focus. Perhaps they started drinking more water. Perhaps they reduced processed foods, sugar, and excess salt. Those changes could explain the benefit. Feeling better might have nothing to do with urine pH and everything to do with eating more nutritious foods and moving more. This confuses correlation with causation. Two things happening together doesn't prove one caused the other. This next mistake concerns me most. Some people become so focused on urine pH that they miss genuinely concerning symptoms. If you experience blood in urine, whether visible or detected on test strips, that needs medical evaluation. It could be a urinary tract infection, kidney stones, or other treatable conditions, but it should be checked. Unexplained weight loss, meaning weight loss without dietary changes or increased activity, deserves attention. It's not always serious, but it shouldn't be ignored. Persistent pain that's new or worsening, especially abdominal pain, chest pain, or bone pain. New lumps anywhere on your body that don't go away. Significant fatigue that interferes with normal activities and doesn't improve with rest. Ongoing changes in bowel habits lasting more than a couple weeks. Those deserve medical evaluation regardless of what your urine pH reads. The strip is not the story, you are. Your symptoms, your function, your quality of life, these matter more than a number on a test strip. After 30 years in medicine, I've learned something important. People can become prisoners of numbers. Blood pressure checked 10 times daily. Blood sugar tested after every meal and snack. Heart rate monitored constantly. Weight checked multiple times per day. And now urine pH added to the list. The goal isn't perfection. The goal isn't hitting exact targets every single time. The goal is health, overall well-being, maintaining function and independence, enjoying life. And those are not always the same thing as perfect numbers. I've seen people with perfect test results who were miserable, anxious, and focused entirely on measurements. I've seen others with imperfect numbers who felt great, stayed active, and lived fully. Here's what I wish someone had told many of my patients years ago. Health is usually built through consistent behaviors, not constant measurement. Eating well most of the time matters more than obsessing over every bite. Moving regularly matters more than perfect exercise programs you can't sustain. Managing stress and maintaining social connections matter more than most people realize. The research is clear. A morning urine pH below 6.0 does not prove cancer cells are multiplying in your body. That's not how cancer is diagnosed, and it's not how modern oncology works. Urine pH is influenced by many normal factors, including diet, hydration, medications, kidney function, and natural metabolic variation. This isn't speculation or opinion. It's based on decades of physiology research and clinical experience from thousands of physicians who've cared for millions of patients. Here's exactly what to do instead of worrying about urine pH. Stay well hydrated unless medically restricted. Drink water consistently throughout the day. Monitor urine color as a simple hydration check. Follow a balanced diet rich in vegetables, fruits, and minimally processed foods. You don't need perfection, you need consistency and variety. Stay physically active most days of the week. Walking counts, housework counts, gardening counts. Find movement you enjoy enough to maintain. Keep up with recommended cancer screenings, colonoscopy, mammogram, low-dose CT for lung cancer. If you're a smoker, these evidence-based screenings actually save lives. Discuss concerning symptoms with your physician rather than relying on urine strips alone. Real symptoms deserve real evaluation. What should you expect if you follow this approach? In the first week, you may notice better hydration and energy if you were previously dehydrated. You might sleep slightly better. Small improvements often appear quickly. By several weeks, healthy habits become easier to maintain. Your body adapts. Walking feels less effortful. Healthy foods start tasting better as your palate adjusts. After months and years, those consistent behaviors contribute to healthier aging and greater independence. You maintain muscle mass better, your cardiovascular system stays healthier, your risk for preventable diseases decreases. Important safety reminder: if you have kidney disease, heart failure, diabetes, or other chronic conditions, always follow guidance from your healthcare team before making major changes to diet or fluid intake. These conditions require individualized approaches. And never stop prescribed medications because of information from the internet. Medication changes should always involve your physician. You have more control over your health than you've been told, not because of a urine pH number that fluctuates daily, but because your daily choices influence sleep quality, mobility, cardiovascular health, metabolic health, immune function, and overall quality of life. The patients I've seen age successfully weren't genetically superior. They weren't lucky. They consistently practiced simple habits for years. They walked regularly. They ate reasonably well. They stayed socially connected. They managed stress. They saw their doctors for appropriate preventive care. That's the real difference between those who thrive after 60 and those who struggle. This video is for educational purposes only. It is not medical advice for your specific situation. Always consult your physician before making changes to your health routines, medications, or treatment plans. If this type of evidence-based analysis is useful to you, please subscribe and like. In the next video, I'm covering common blood test numbers that are frequently misunderstood after age 60 and what they actually mean. And before you go, comment below. Have you ever tested your urine pH and what were you told it meant? I read every comment and your questions help shape what I research next.